Hey friend, welcome to a special mini-series on the Exam Room Nutrition Podcast that I am calling Sneak Peek Week. All week long, I'm sharing bite-sized gems from the expert speakers inside my freshly launched Obesity Medicine Nutrition Course. I'm giving you a sneak peek of what's inside and how it can help you feel more confident in clinic. The Obesity Medicine Nutrition Course features 11 hand-selected experts who are on the front line of obesity care, nutrition, and behavior change. The course is on demand and you can learn on your commute, between patients, or while you're reheating your coffee for the third time. Now, don't forget, I'm offering a special discount for my podcast family. Just use code POD15 at checkout for an exclusive 15% off the course. Go to examroomnutrition.com/course to join. Now, today you'll hear from Nina Crowley, a registered dietitian, health psychologist, and body composition queen. Her presentation inside the course unpacks why using BMI alone is insufficient and gives us a fresh take on body composition and why it matters way more than just watching the scale. All right, get comfy and enjoy the first episode of Sneak Peek Week. Nina, thank you so much for chatting with me all about your talk on why BMI alone is not a great indicator of body composition and how clinicians can utilize body composition analysis scales in their practice and why it matters for their patients. So thank you so much for unpacking your topic with us today.
Thank you for having me. I'm really excited to talk to your listeners about what they can be doing in a very quick and easy, feasible way in their practice. I think bioimpedance has been a really important technology that's been around a while, and I think it's a really important thing that we should really have as standard of practice for clinicians.
I think so too. That's why I brought you in to be a speaker for my course, for the Obesity Medicine Nutrition Course. And your talk on going beyond BMI and implementing a bioimpedance analysis in clinic is one of the best. And so I would love if you could just summarize your presentation in one sentence. What would you say?
Oh, my sentences are run-ons. So I'm going to tell you all about the ins and outs of body composition and, importantly, how to counsel and talk to your patients about their data and numbers to help inspire and facilitate behavior change.
Spot on. That's exactly what that presentation is. Okay. But if we dig a little bit deeper, what are a few key takeaways that clinicians will learn from your presentation?
So I wanted to rewind a little bit and go between, when I went to school till now, 20 or something years between what I learned about body composition. I think others are stuck a little bit in that, hey, is it underwater weighing? Is it DEXA? This is not something we can do in practice. Or, they're thinking about those old handheld bioimpedance devices they had. There's so much more to offer. So I go through all of the kind of the big picture. What are the ways we can assess body composition and why that's important? And then really what's always important to me is not just data and numbers, because we know that that's not enough to help people change their behavior, but really connecting the data points and what's of interest. So muscle mass, I think, is really important. Looking at adiposity and where that is. So visceral adipose tissue, metrics like that, connecting that to the things that people are doing in their daily behaviors that they can work to continue to strive for. And I think having better goals to set, fitness goals, body composition goals that can be modified and changed throughout the life cycle, that we always can be striving to improve. I think that's a really important way to frame these numbers and get people away from just that number on the scale that once you get there, it might be exciting, but it's not that easy to stay at. And so I think we can really enrich the conversation around outcomes in this area.
Yeah. And one of my favorite pieces of your presentation is how you gave the learner scripts and talking points for their patient and like how to say certain things and how to guide them on goals beyond weight. I think this is something that is missed in obesity medicine is like we focus so much on weight loss, but at the end of the talk, you had given us some ideas for non-scale victories. And I think that's such a great thing that learners will be able to take into their practice going beyond just weight loss alone. So you guys are in for a real treat in learning more about body composition, but also going beyond just encouraging weight loss alone. Okay, Nina, you're the body composition queen. And so from your experience, what has been the biggest misconception about body composition analysis?
Oh, okay. Again, you're trying to cut me down to a hard little single line. So I would say, one of the things that I talk to providers the most about they're under the impression that DEXA is a gold standard and really the only way to look at someone's body composition. And so I think the biggest misconception is that bioimpedance is not as accurate or as feasible for them as it is. And so there's been lots of research over the past 25 years since you probably learned about it in school. And the technology has increased dramatically and the numbers are really good. I mean, we're looking at 97 or 98% accuracy to the actual gold standard for fat mass is the 4-compartment model and the gold standard for muscle mass assessment with the whole body MRI. So we can get really good and really close body comp data on our patients and be able to help encourage them to, move towards reduced adiposity, increase muscle mass over time. And I think that muscle mass is something we really all need to be talking about kind of independently of the weight conversation.
Yeah, I agree. Okay, so we can't talk about body composition without talking about BMI. And a lot of us who've been out of school for some time, that's what we were trained on. We were trained to measure and track BMI. So why are we even talking about body composition? Like, why aren't we just using BMI anymore?
I think there's a lot of things that have evolved and changed around that conversation, but really just the quality of someone's weight loss is becoming important. And so I don't think the BMI is going away. I actually think for screening purposes and, in that really early on diagnosis and classification may still have a role. But really what I care about is the patients that you're with. How do we continue to motivate them and show them their, individual response to treatments? The being able to look at what's happening inside and pivot and make changes based on that data, that's individual level data. We can't predict what someone looks like on the inside. Someone with a low BMI might have very high visceral adiposity. That's unhealthy that they want to work on. Someone who's got a high BMI might have very low visceral adiposity and a strong, fat-free mass or muscle mass. And so it really helps get deeper into the individual's sort of, classification, but goal setting and long-term, tracking over time is really where I see it be super valuable.
Nina, thank you so much for your contribution to this course. So if this mini conversation piqued your interest and you are interested in learning more about body composition, but also going deeper into obesity medicine, nutrition, and anti-obesity medications, go check out the course at examroomnutrition.com/course. And don't forget, I'm extending a 15% off discount to my podcast family. Just use code POD15 at checkout. That's POD like podcast. And we'll be back tomorrow for a quick chat on behavior change strategies. All right, I'll see you then.